no. I don't like where this is going. I'm gonna save your life because I'm a doctor. She should be disciplined for this, absolutely.
Skateboarder versus car.
Well, he's crashing. Where is that blood?
Right here, doctor.
He has a medical ID. It must have broken off.
Oh, God.
Okay, stop. He's a Jehovah's Witness. We can't give him blood.
This is not actually how Jehovah's Witnesses would declare that they don't want blood transfusions. Usually what they have is a card that they carry in their wallet, and instead of just saying Jehovah's Witness on it, it would say, I, name, am a Jehovah's Witness, and I refuse to have blood products, or I refuse to have a blood transfusion. And the purpose of this is that it makes it a legal and valid advance directive. So instead of just saying Jehovah's Witness, which is not very informative, it is making a specific refusal, saying these are the things that I do not consent to. So if somebody came into the hospital and their tag just said Jehovah's Witness, I don't think that that would actually be enough information to go on to tell the team what to do. There are some Jehovah's Witnesses, definitely in the minority, but there are some who will accept blood products. And so just saying Jehovah's Witness is not going to clarify that. As well, that if somebody is a Jehovah's Witness, it's pretty well known that Jehovah's Witnesses typically don't accept blood transfusions. But if you just have a tag that says Jehovah's Witness like that, somebody might not know what that's supposed to mean. Thinking a bit bigger picture about this situation, getting a blood transfusion is the sort of thing that the medical team needs to get consent from the patient if the patient is capable of giving consent, or the team has to get consent from a substitute decision maker in most situations. The exception to that is in an emergency such as this. This patient is near death. He's almost about to die. And so in that kind of case, the law typically says that doctors are allowed to do whatever is necessary to save the patient's life. So if they believe that the patient needs a blood transfusion, or they believe that the patient needs surgery, they don't have time to get informed consent from, obviously the patient is unconscious, or from the patient's family, because they don't know who the patient's family is. So they are allowed to do whatever is necessary. The exception to that is a case where they have some evidence that the patient would not want to have whatever the thing is that they're considering doing. So in the case of a Jehovah's Witness, if they found in his wallet a signed card that said that he doesn't want a blood transfusion, that kind of thing. I made another video where I talked about people who have DNR tattooed on their chest and talking about the ethics and the law around respecting that kind of decision. And we went into that in more detail. So you can proceed as a doctor to treat somebody to save their life as long as you don't have kind of significant or substantial evidence that the patient wouldn't otherwise refuse it.
We're seriously repairing an aortic dissection without blood.
Yeah, we have no choice.
We could use blood.
We could also be arrested for assault and battery.
I'm not joking.
So Dr. Yang here is telling the resident the correct view that to do something to somebody, give them a transfusion, perform surgery, whatever, without their consent or without the consent of a substitute decision maker is assault. And the law has been really clear about that, actually for about 100 years, going back to the 1910s in the United States. So if they have evidence that a patient would not want to get a transfusion and then they override that, then that would be assault. So Dr. Yang is absolutely correct about this.
I can't cut. I lose too much blood.
What do? We'll go in percutaneously.
Get the OR ready for an endovascular repair. Let's move.
Because it's well known that Jehovah's Witnesses do not accept blood transfusions, hospitals have developed procedures where they can do bloodless surgeries. Now, there are lots of different procedures, and different ones require different amounts of blood in a typical kind of non-Jehovah's Witness intervention. But there are many procedures that that doctors can do successfully on Jehovah's Witnesses without requiring a blood transfusion. So part of the difficulty about this situation is that the kind of injury that the patient has, that would typically be one where they have to give him blood, or where they would give him quite a lot of blood. So that's the difficulty, is navigating this. But in other cases where it's not an emergency like this, it's actually this kind of stuff is fairly well sorted out. And the success rate, I think, in some of the procedures is pretty good.
How's he doing?
It's touch and go.
I swear, we hung out practically every day, and he never once mentioned to me that he was a Jehovah's Witness. He never talked about it. I kind of don't think he is.
Well, maybe it was just a personal thing.
Maybe, but I mean, if you believed in something so hard that you would die for it, Would you keep it a secret? Wouldn't you at least tell your friends?
Yeah.
This is a good example of the process and the difficulty of figuring out what a patient would want when we can't talk to the patient himself. So ethically, we want to make sure that the interventions, the things that we're doing to the patient are things that, to the best of our knowledge, that he would consent to. And we do that by talking to different people and trying to get a sense of the patient. But what's difficult about it is that it's not really that we can kind of go around and like investigate and collect evidence and then kind of make a final decision. The way that the law works is that there is a legal substitute decision maker. In this case, it's probably his parents. He might have a spouse, but we don't know that yet. And they would be the people who are the legal authority to make decisions on his behalf. Even in that case, what the doctors should do is talk to the substitute decision makers to figure out not just kind of what they think is best for him, but also what they think he would choose for himself. So this kind of evidence that the doctor has just got from this friend, this is really interesting, and it's kind of making it more complex. That now there's this like doubt about, well, was he actually like serious about being a Jehovah's Witness if he never mentioned it to his friend, this guy he knows really well? But maybe there are some reasons why he didn't want to do that. So like how much can we actually kind of add in that skepticism or build that in? And that's like something to look into, but it's also not the sort of thing that the doctors could really kind of go, oh, well, now we're like skeptical about it, so we just, get a different substitute decision maker. That's not really how the process works.
What was his last hemoglobin?
4. The guy's on fumes.
Try and stimulate blood production by giving EPO.
Or we could give him blood and cut out the middleman.
We can also give IV iron dextrin.
We can give him iron? How is that logical? We can give him the components of blood, just not blood?
We have to respect his wishes.
What wishes? He can't tell us anything. His friend didn't even know that he was a Jehovah's Witness.
Yeah, it's not the kind of thing you talk about at the skate park.
I'm just saying he's 19. How can he even know what he believes? When I was 19, I was a completely different person than I am now. I wanted to be a radiologist.
Wow. I feel like I'm seeing a whole new you.
So the resident here is really making two different sorts of arguments. The first argument is that she's really just objecting to the doctrine of being a Jehovah's Witness. She's saying it doesn't make sense that Jehovah's Witnesses are against getting blood transfusions, but they're okay with getting some sorts of the components of blood, certain blood products like iron. And my understanding is that that's kind of typical of Jehovah's Witnesses, that they're okay with getting certain components, but they're against blood transfusions. But there are some Jehovah's Witnesses who are against any kind of blood product at all. Now, if we think about this, ethically speaking, it is just not her job to be assessing the kind of logic of somebody's decisions about their life, including their faith. That if it were up to doctors to assess whether their religious beliefs really make sense, and if they don't make sense, then the doctors can override it, that would just give doctors so much latitude to kind of make decisions about people's lives, and that would really violate the autonomy of people to make medical decisions based on their own beliefs. So it just isn't the role of doctors to make these kinds of decisions. And it also isn't kind of the expertise of doctors to like assess whether it's like logically compatible or to like look at the Bible and do like a biblical interpretation of whether Jehovah's Witnesses as a faith that makes sense. Just not her job. The second argument that she's making, which is a more interesting argument, I think, is that she's arguing that this guy is only 19. How does he really know what he believes? She's saying, when she was 19, she had all these different beliefs and she has since changed her mind. So we can't really trust that he was really a Jehovah's Witness, that he's really committed to that. This is a more interesting argument. But I think still that we can't just discount what a young person is saying just because they're a young person. That young people can still be very committed to their beliefs, including people, there are people who are Jehovah's Witnesses or who have other religious beliefs, and they do end up having those religious beliefs throughout their lives. So we can't just say like, oh, they're young, they're going to change their mind. As far as we know, this guy could be extremely committed to his faith. So the fact that he's young, I just don't think cuts it as an argument.
So you're fine with this? Even though he could die, you're fine?
It doesn't matter what I think. He had an alert. It was very clear. No blood. I don't get to have an opinion about it, and neither do you.
Dr. Yang is just totally right there about it's not really her opinion to like decide if being a Jehovah's Witness is a good idea or not. I think she's mistaken about he had an alert and it was really clear. It didn't say no blood, it just said Jehovah's Witness. So if I think we're kind of substituting in if he had a like valid advance directive that said I'm a Jehovah's Witness and I don't want any blood products. But the general point that she's making is that it's just not up to doctors to make these kinds of decisions on behalf of patients. The idea of patient-centered care is that people get to make decisions in line with their own wishes, values, and beliefs. So overriding that because the patient might die is just not really justified.
So there's nothing we can do?
Yeah, there is. We can talk to the family.
It's a little bit weird that they haven't talked to the family yet. I guess that kind of in the timeline of this, that they had him in surgery and finally get a chance to go talk to the family. But I think in reality, if this were happening, that one of the doctors much earlier is like early on, they saw the family there. They would have went and talked to them right away and figured out who the substitute decision maker is, give that person an update and so on.
He's lost a lot of blood. What would really help is blood transfusions.
No. We believe that life is a gift from God, and we don't try to sustain it by taking in blood.
Without blood, his organs will start shutting down. As his surgeon, I urge you to let us give him the best chance we can. Let us give him blood.
A thing that stands out to me about this interaction is that neither the doctors or the family are using any kind of what we call values-based language. So the parents are saying that we don't believe, or here's what we believe. But what the doctors should be doing is guiding the parents to talk about the values of their son, like talk about what he believed and that he is a Jehovah's Witness and that it was important to him in this way. So when I'm having these kinds of discussions, if the family is talking about their beliefs or what they would do in this situation and other things of that sort, then it's not that they're like making a mistake or trying to like, I don't know, kind of pull a fast one or anything. They're reasoning in a justified way, but it's guiding them to think about as substitute decision makers that they should be putting themselves in the place of the patient and thinking, what would that person do? So whenever they use that kind of language about their beliefs, then we say, okay, but what do you think the patient himself would say? The other thing is that I find Dr. Yang here kind of crosses a line, that she's saying that he really needs blood, but then she crosses a line, I think, by saying, let us do this, I really urge you. And the better way, or what she should be doing, is saying that what we really want to do is make sure that we're giving him the best treatment possible in line with his beliefs. So she's kind of suggesting here that the parents are making a mistake, which I think is also kind of in violation of patient-centered care.
I hate her. Look at her all mopey face just because she didn't get her way.
I don't like where this is going. Oh, no.
You want to stop right there?
They've installed these cameras and there's this other doctor who's watching the cameras to kind of help out. That's the guy who just caught her doing that. In ICUs, it's actually fairly typical now that there will be a camera pointed at the bed, but there's not usually a person who's we'll talk through it. So what this doctor has done is like really, really wrong. She's basically saying like, I do not let you be a Jehovah's Witness, that I'm going to give you blood and I'm going to save your life because I'm a doctor and like, I'm going to heal you. And she's just disregarding what the patient, like as far as we know, what the patient wants. So just overriding a patient's refusal to get blood or overriding any kind of treatment decision is just like the most old school medical thing that doctors used to do all the time and they still try to do on occasion. And it's wrong. It's wrong because it overrides the patient's autonomy to live how they like. People have the rights to make decisions to refuse treatment, to not go to the hospital at all. And if this person would rather stick to his faith and be a Jehovah's Witness, even that means that he would die. That is just his right to live how he wants and to die according to his beliefs. The doctor, even if she's like believes that she's acting from a good place because she wants to save him, which is what doctors are typically in the business of doing, she's making a terrible ethical mistake by doing this. And this would be assault. She should be punished. Maybe even lose her license.
You tried to give blood instead of fluids? You never administer anything to a patient without my orders.
I thought that he deserved a chance.
You have passion. I get it. You still have to do what I say. I am your boss, and I am trying to save this patient's life.
The reason she shouldn't give him the blood is not because Dr. Yang said don't give him the blood. The reason she shouldn't is because he doesn't want the blood. He's refused it. That is the basis of his faith. So it's kind of a strange argument for Dr. Yang to say that you broke my orders, that's like the basis of what you've done wrong. That even if this intern were the attending and she was making her own decisions about his treatment, it would be wrong in that case to give him the blood because he doesn't want it, not because of any kind of order or anything.
What are you gonna do? Get her fired?
She didn't do anything. There's nothing to tell.
She's right, He's circling the drain.
A suggestion here that they're just going to cover it up, which I really hope does not happen. She should be disciplined for this, absolutely.
Okay, I'm calling it. Time of death, 6:42.
So obviously super sad that he ended up dying, that they weren't able to save him. But I think that ethically speaking, that this went the right way, that they recognized that he had this belief, that assuming that the family verified that he had this belief and that this was something that he held deeply. And when he, again, supposing that he had filled out the card and that he had signed it and so on, that that process is being informed about knowing what the stakes are. And these situations are extremely rare. So I've never had a situation where I've been consulted about an emergency case like this. I have been asked about cases where it's a Jehovah's Witness who has decision-making capacity and is still and is refusing blood, and then there's a kind of a whole process for it. So I've been brought into a couple of those cases. But I mean, really, there aren't that many Jehovah's Witnesses, and thankfully, there just aren't that many kind of incidents like this where this kind of thing comes up. But they do happen. And I think that the right thing to do in these cases is to respect the person's wishes, just like we should respect any kind of refusal or any kind of advance directive that somebody's making. The fact that they're making it because of their faith instead of some other reason, or the fact that they're young, I don't think should change our assessment of it. We respect people's wishes because that's an appropriate way to treat somebody. That's what it means to treat somebody ethically, even if it's not based on a belief that we share, or even if it's not something that we think is the right call. We still respect people's choices in medicine. All right, thanks everybody for watching. If there's another episode of a show that you'd like to see me comment on, please leave a comment down below, and we'll see you in the next one.